Okay, good morning. Again, I'll talk about gynecomastia surgery, and I'll show you some of the results and some of the hazard in bodybuilders and athletes. The only financial closure I have is that I wrote a book that is on Amazon. The name of the book is Masculinity Defined. This gynecomastia became a very exciting field for plastic surgeons because, as you saw before, every year there's a few percentage people that are more aware and do the surgery. This is the book. Okay, this is a typical bodybuilder. And it's really that's the way I mark them. I palpate the gynecomastia, and that's about a typical specimen. The incision that I make is less than about an inch, and you can see that the gynecomastia specimen is about 6 inches in diameter. Okay, it's a limited infrareolar incision, oriented more laterally because I found that laterally it's a little bit less conspicuous. And I removed the entire gland, which is the tail, the head, and the body of the gland, and maintain only 2 to 3 millimeter thickness under the areola. Okay. I'm more cautious to under my laterally because there are two main arteries, the lateral thoracic and the thoracodorsal, and if you hit those arteries, it takes a long time until you can find it and ligate the arteries. Avoid also penetration of the pectoral muscle because then you're going to have more hematomas, deformities. So meticulous hemostasis is very important, especially in bodybuilders that usually they take fish oil, omegas, and also the steroids. So be very careful about hemostasis. Again, bodybuilding is highly vascularized, so then you have to make sure that you stop the bleeding. The fat layer is thin, so it's easy to penetrate the pectoral fascia. I found with secondary one that I do that I would say certain excision are not complete. So make sure that the excision of the gynecomastia, the gland, is going to be complete. And because the bodybuilders, they really have early range of motion, they can't wait, and then they have more bleeding, hematomas, and seromas. The photography is standardized. I'll show you how. It has to be exact before and after, and there are like 5 aspects, front, oblique, and lateral. Like this you can, and also I take the entire body. I include not only the chest, I include the neck and the abdomen and the arms. In this one, it's a little bit atypical because he had in one side, and the left side, he has more gynecomastia laterally. So it looks like a triangle, and we want a circular shape, which is aesthetically much better. This is the same patient. Okay, this patient you can see he tried the medication, exercise, diet, nothing really worked. So then we did an excision, and you can see the entire body. It's the physique with the gynecomastia corrected looks much better. Same patient. This is another patient that after the surgery was motivated actually to develop his abdominal muscular. Okay, here there is significant asymmetry. I'm not going to go to the technique because he has excess skin, so the technique is a little bit modified, but basically it's only one incision, subareolar incision of about an inch, and I correct the ptosis and the asymmetry. Same patient. Okay, this is another bodybuilder. He had it's a Poland-like syndrome in the left side, laterally. Again, here I did also, he had some adipose tissue. Usually most bodybuilders, I just do excision of the gland. I rarely do liposuction or excision of the fat. Here, I had to do both of them. Again, this is excision with some liposuction. That is unusual in my practice. This is also a bodybuilder that competes, and this is before and after the surgery. Here you can see that once we correct the gynecomastia, the shape of the breast and the entire body is better. It's better physique. Here I had what they call puffy nipples. So as you know, it is a really good change. This is just to show the scar. Usually the scar is right there, and it's absolutely minimal. It's hard to see it. Now, the NAC shrinks usually between 20 and 50%. The scar is usually inconspicuous. You can see the glandular protrusion, and the post-op pain is luckily minimal. I give medication only between 5 and 10% of the patient. At least 90% of the patient don't get any pain medication. We didn't have any necrosis of the areola, and in Banelli, I don't do Banelli because of the possible necrosis of the areola. And I don't think there's a need to do Banelli. Again, avoiding the penetration of the pectoral muscle. Okay. So before surgery, they have protrusion of the gland when weather, room temperature, and exercise. And after the surgery, you can see better the silhouette of the pectoralis muscle, which is masculine. When competing bodybuilders is in competition, the judges usually don't notice the puffiness and the scar, because I asked them, only 2% of them said that the judge didn't notice the scar. 98% said that the judge didn't even know that they had the surgery. Okay, thank you.